The World Heart Observatory is a fantastic project of the World Heart Federation. It's basically a global platform that collates data from different sources, from WHO, from GBD, from some of our main partners. It's a work in progress. And one of the main goals is actually to have one site, one-stop shop, where we can actually retrieve the data that we need to have a picture of the landscape of cardiovascular issues. And one of the main goals of this observatory is actually to achieve better equity, to be a tool to develop strategies that we can tackle what is a big issue in the global terms, which is the lack of equity, so inequity. So this is actually one of our main goals to develop the observatory, is by using this tool to be able to address this very important neglected area of inequity. Inequity, unfortunately, it's a problem that affects many parts of the world, and sometimes even in the high-income countries. So there are many ways that we can develop, or there are many strategies that we can develop in terms of trying to minimize these inequities. And the World Heart Observatory, to have data is knowledge, data is power also. So to have that sort of tool can actually help us to develop that. On the other hand, there are other ways where we can address also this issue of equity. Developing, for instance, our roadmaps, which one of the main goals is actually to identify the barriers for implementation of guidelines that we know that can have better outcomes in the management of different medical conditions. That's also a tool that we at WHF are developing, these roadmaps, and together with our members, we're developing also different types of activities where we can address these issues, and very importantly, try to find what are the barriers in certain regions, what are the solutions that can be applied in those regions that can work to better do implementation of guidelines and implementation of strategies that can help us to tackle cardiovascular disease. Another important element has to do with increasing the awareness of cardiovascular conditions and cardiovascular diseases as a whole. And our advocacy team is working very, very hard in terms of developing, again, strategies that can help us to develop models that can improve that in that way. We are addressing specific issues which again have an impact on inequity, such as air pollution, tobacco, alcohol, all these different areas where we do have expert groups that are dealing with the topic. Again, trying on one hand to increase the awareness of the different issues, but at the same time trying to develop strategies that can help us to address what are the main barriers, what are the main issues, and what solutions we can implement to overcome those. So it's a long work, it's work that will never stop, and that's where WHF as a global platform can play a significant role. Cardiology is one of the fields that has had more significant developments in the last few years, and that has to do on one hand with the development of technologies that enable to understand better cardiovascular disease on one hand, so from the molecule, from the cell to population level. There have been different novelties and different innovations that actually help to tackle cardiovascular disease. And that goes from treatments, for instance, new drugs, new devices, new indications for these drugs or devices, sometimes simple solutions. We're going to have at this Congress some important results, for instance, from trials showing that the use of fixed-dose combination can actually improve the management of some conditions and even address cardiovascular disease, to more complex aspects related with some genetic conditions, even with some gene therapy, and with the development also of an inclusion of some new drugs and some new devices in the treatment of cardiovascular disease. In the prevention area, there are also some interesting developments. In diagnosis, the technological developments in imaging, for instance, have been quite fantastic in providing better ways to early identification of some conditions. Amyloidosis is certainly one of them, among many others. So it's really fantastic to see these different developments. And of course, one big area, which is relatively recent, is the whole area of digital cardiology, digital health, the use of artificial intelligence and some new digital tools that actually also help to tackle cardiovascular conditions, cardiovascular disease, and also to improve cardiovascular health. So it's not only on the disease side, but also on the health side that some of these novelties have been able to develop some strategies that can help us to tackle better cardiovascular health as a whole. so to have a more healthy population. Well, first of all, to recognize the problem. That's one of the big issues. This is a global issue affecting more some parts of the world than others, but it's a global issue. So to acknowledge the problem and to develop the right strategies to reduce air pollution, to improve and address the issue of climate change, which is, of course, there's a big political component here. But that will be the first, I would say, the first advice that we as a medical organization or as a global organization would very much working in that regard. That's advocacy, is to increase the awareness and to make sure that it's recognized, so then strategies can be developed. And then it's in our hands, every single one of us. You know, this is a problem which affects the whole world, and every single one of us, from energy reduction, consumption of certain areas, that can actually help also to address the problem of air pollution. So it goes from the individual to the governments, to the states, to the regions, to develop the strategies to address what is a very important problem that is affecting already our generation, but certainly will affect the next generations. And that's why it's so important that we develop strategies that can help to minimize the impact of air pollution and minimize the impact of climate change.